First of all, the most patient man in the world is Barack Obama. He sat through that and listened to everything and was so patient and responsive. It was an issue-oriented meeting. The president let everybody talk and talk and talk. And I think that there's so much agreement, but yet every Republican used the same talking points. Every member of Congress used the same talking points. And we want to do a bill for the American people. And we're going to continue to work very hard. We're ready to do it. The president said we have to do something very soon, and I agree with him. But we're willing to work with them. But time is of the essence. American people waited 5 decades for this. It's time we do something, and we're going to do it. Madam Speaker?
Thank you, Mr. Leader. I agree with the distinguished leader. Our president is indeed a great leader in that he has a vision for our country and about how we move forward with health insurance reform. He is striving to build consensus. He is listening for any common ground and extending an invitation for that. And so I'm hopeful that something may come of it. I'm not overly optimistic that we would get Republican votes for the bill, but that doesn't mean we couldn't incorporate some of their good ideas into legislation should they put some on the table. The president 1 year ago had us all here at the White House, March 5th, where he had his health summit, which was bipartisan at the time, and began the debate which over the past year within the committees of jurisdiction and in the Congress, he has sought bipartisan support that continued until today. I hope that something will come of this. I use the analogy of the kitchen table. As we sat around the that table in that room, we have to represent the aspirations of Americans as they sit around their kitchen tables, concerned about their jobs, the education of their children, as well as their health care costs and how they're going to pay their medical bills. Those people who are, again, struck with illness or pre-existing conditions and the rest want us to act. They want results. We can't say to them at the end of the day, well, we had an idea, we had a vision, we had a majority, but the process did not allow us to make a change for your lives. We need to have the courage to get this job done, and we will. And I think today took us a step closer to passing health care, to improve health care, to lower cost, and to make it much more accessible to many more Americans. I salute the president for his leadership. Mr. Durbin? Mr. Durbin? Oh,
I just want to make 2 points. First, to thank the president for bringing us together. It was a long day, and it was a day where he was open to everyone's comments. There were 2 things that came through clearly to me. First, though we agree on many basic things, we feel that any bill that is going to serve the American people has to have the kind of regulation of insurance companies so that people understand that when they buy a health insurance policy, it will be there when you need it. The whole issue of pre-existing conditions. If we allow the insurance companies to turn Americans down by the thousands and hundreds of thousands because of pre-existing conditions, we're not going to give them the peace of mind and security that they need. Secondly, I looked around that room and realized that virtually every member of Congress in that room is part of a health insurance exchange run by the federal government with imposed minimum standards on the health insurance companies. Our Republican friends who find this so objectionable for the rest of America live with it every day. We should offer to the American people the same kind of health insurance coverage that we enjoy as members of Congress.
Thank you. Stony Hoyer, the Majority Leader of the House. I've been in the House for almost 30 years. I've lived in the Washington area for a long period of time. I cannot remember a similar event. I cannot remember a President of the United States spending an entire day sitting with some 30 members of Congress discussing an issue, displaying an extraordinary depth of knowledge of that issue and an extraordinary passion to accomplish the objectives of that legislation. My view is that this meeting was worthy of the objective we seek, worthy of the objective of including all Americans with access to affordable health care. You've heard that mantra, but that is reality. And what we saw in that meeting was a difference, a philosophical difference, a difference of scope. One party, the Republican Party, having a bill which essentially includes 10% of those who are uninsured. And we believe that all Americans needed to be included. That's a substantive difference, but there were also areas of agreement, and we pointed those out. And many of the areas of agreement that Republicans sought have already been included in our bills. We hope that based upon this discussion, we can move forward. But move forward we will to accomplish the objective that all of us, including the President of the United States and including John McCain, said were the objectives of including every American. And that is the phrase of John McCain, every American in affordable health care.
Is the ball in the Republicans' court now?
What do you mean by that? The fact is that we are going to move forward. The ball is in everybody's court to try to find some common ground on how we move forward. Mr. Durbin pointed out the defining difference that emerged in this meeting, though, and that is in order to make the changes, in order to end discrimination on the basis of pre-existing condition and all the reforms that we want to make, in order to hold the insurance companies accountable, there has to be some regulation of the insurance industry. That seemed to be the big separation between the Democrats and the Republicans. Whether that can be bridged remains to be seen. My colleagues, does anyone want to? Oh, they left.
How can you find common ground, though, if Republicans are saying the only way to move forward is to start over? It was what they were saying before the
First of all, one of the first speakers was Dr. Coburn, and he laid out this very logical approach as to what should be done with health care. The president came back and said, "That's interesting. Everything you've talked about is in our bills." So, if logic has anything to do with reaching agreement, it should be pretty easy.
Leader Reid. Thank you.
Let's get warm.